So 10 years ago, our daughter Yagazie was born. Yagazie is the Igbo word for it is well or it shall be well. As you can imagine, my wife and I were excited. The first time I set my eyes on Yagazie, I think I practically fell in love with her. Yagazie's grandparents couldn't wait to meet her because she's their first grandchild. Now, fast forward like 3 weeks after, we noticed that all was not well with Yagazie. Yagazie couldn't feed very well. She couldn't breastfeed very well. She was losing weight. She was sleepless. She was highly irritable. She was turning blue most of the time. As you can imagine, my wife and I were really, really worried, as new parents. And as a doctor, we took Yagazie to the hospital, and Yagazie was diagnosed to have congenital heart defect, 4 different types. The most serious of the defect that Yagazie had is called transposition of the great arteries, which means that in layman's terms, that 2 major arteries in the heart arose from opposite sides of the heart. So all of a sudden, a thing of joy, we're now faced with financial disaster. How are we going to raise the money to take care of Yagazie, to stabilize her, and maybe even provide, take her for open heart surgery? I'm a doctor. I had just come back from the UK 2 years before. I was working with an international NGO. My wife was working with an international NGO. But yet, we did not have that kind of savings, thousands of dollars to be able to provide the kind of care that Yagazie needed. Despite the fact that at that point in time, we were privileged because, like I said, I'm a doctor and we worked with very good organizations. So it hit me then that for us who are privileged and yet did not have the money to provide the kind of care that Yagazie needed at that point in time, what is the fate of other Nigerians, other poor Nigerians, other voiceless Nigerians that didn't have the kind of privilege that we had? And really, I think when I look back now, that was the first time that I really decided to advocate for universal health coverage, which means simply that nobody should be denied health care for any reason, and nobody should be pushed into poverty because they are trying to pay for health care of any kind. This year, after I got my letter that I was selected as an Atlantic Fellow, I was excited. Before I even came, I had decided on my project topic. I wanted to focus on the health inequities that low-income earners in Nigeria's federal capital city, Abuja, where I live, face. But by the time we got to DC during our first convening, listening to everybody talk about the work that you do, the one that really resonated with me was Brandy's work, because she talked about the kind of inequities that her people, Native American Indians, face in this country. And it took me back to my city. Because before 1991, Nigeria's federal capital city was in Lagos. 28 years ago, the capital city moved from Lagos to Abuja. And for that to happen, that meant that people were displaced from their lands. So I decided then that my project was going to be on the health inequities facing indigenous communities in my own capital city. I raised a team of 8, and we started the work. What we really wanted to do, what we set out to do, was to amplify the health inequities faced by these people. We didn't want to assume that we knew what they were going through. We also didn't just want to be spokespersons for them. We wanted to go to their communities, interview their leaders, interview households, to find out these inequities and amplify them. And that was what we've been doing for the past 11 months now. As you can imagine, once we started going to the communities, we found out that the inequities were legion. There were so many. Some of the members of my leadership team did not even know that some of the communities existed, the kind of inequities that we saw. But 2 come to mind. The first one is Martha. Martha was in her early 30s, lived in a community called Sauka, which is just about 10 kilometers from where Nigeria's president lives, about 5 kilometers from where our lawmakers, their official residence. And yet, in that community, there's no primary healthcare center. Martha was pregnant. She attempted to deliver at home. The labor did not go so well. Once the head of the baby crowned, they realized that this head cannot come out. They had to rush her from that community about 15 kilometers away to a hospital. When they got there, obviously, the people on call noticed that they couldn't do anything for this woman. And they drove her to a private hospital. And I want you to think about it, a woman who is in labor, the head of the baby had crowned, the pain, the bleeding, everything that she was going through. When they got to the private hospital, Martha died. And Martha left 3 children for her sister, who is battling to take care of them. And I think when I look at it, the only offense that Martha committed was giving up her land for our own federal capital city in Abuja. Apart from Martha, we also interviewed a young woman who told us about her brother. Her brother is now 15 years old, but he's been peeing blood for the past 3 years. And as a doctor, once I heard it, my first diagnosis was this child obviously has schistosomiasis, which is an infection you get from not having access to good water. And indeed, in that community, they don't have access to good water. Their major source of water is a stream where animals wade through. And that is where they drink from. And you see, any community that we go through, as we do the interviews, we get the consent of the people, we record videos, and right there and then, we amplify on social media. We tag other organizations working in health. We tag the Federal Capital City Administration, saying that these things are unacceptable. That boy's case was picked up by different organizations who actually took it upon themselves to go to the FCT Health Department and officially demand that things must be done. Eventually, they went there and did mass drug administration. The drug that this boy should have gotten since that's free, they went to deliver the drugs. Obviously, the bleeding will stop. However, the major issue, which is lack of clean water in Nigeria's federal capital city, had not been dealt with. So maybe in another year or two, this boy would have schistosomiasis again and start peeing blood. And for us, just going around these communities, interviewing these people, hearing their stories, kind of brings me back again to Yagazi's experience. So we were only able to pay for Yagazi's surgery because both of our employers, my wife and I, gave us loans. It was a very confusing time for both of us. We didn't know where to get the money from. But they gave us loans, and because of the loans, we were able to take our daughter to India, where she was operated on, and the defects corrected. I remember the first time that they came back and I went to the airport to pick them up from the airport. Before the surgery, Yagazi hadn't smiled at all. I can still remember when I saw her the first time, she smiled. And she was fair. We just showed you that because of the defects, that was where she was dark all this while. And anytime I think about it, I'm like, this is not something that I really want any family in Nigeria to go through. Because I know what it is like. But in Nigeria, every day you are inundated by people asking for all sorts of support on social media, on print media, on radio, for different reasons. So for us, my leadership team and I, we have decided that this is not a project we're going to stop. This is something we have to do in perpetuity. We will keep going to different communities, interviewing people, recording their videos, and using that to drive advocacy, to improve their living conditions and obviously provide health services for them. And anytime I think about universal health coverage, an Igbo word comes to mind. That word is Igwebike, which means there's strength in community. And if you think about it, everybody here is working towards universal health coverage. Whether it's, you're an artist, whether you're working with the police commission, a pediatrician, whether you're working with women, children living with disabilities. We're all working towards universal health coverage. And I think that that word that talks about the strength in community means that we cannot allow, no one should be left behind. And I like what Shuba said. No child with disability should be left behind. No woman should be left behind. Nobody should be left behind. And if you think about it again, I think community to me also means that together we need to collaborate more, work more, because one of the benefits of this kind of fellowship is fostering international collaborations, helping, supporting each other to make sure that in the different countries where we work, where we come from, that no child, no woman, nobody is denied healthcare simply because of where the person comes from, the person's ethnicity, the color of the person's skin, the person's income. Health is a human right, and I think we should work towards ensuring that that right, everybody has access to it, and everybody lives it to the fullest. Thank you.